My name is Samantha Turcotte, and my DNP project is the implementation of practice guidelines on early screening of hepatitis C in the primary care setting. Hepatitis C and symptoms. Hepatitis C is an acute or chronic virus that causes liver inflammation. Symptoms of hepatitis C infection can include jaundice colored skin, which would be yellow discoloration of either their sclera or their actual skin, potential abdominal pain, as well as dark colored urine. Some facts regarding hepatitis C is that hepatitis C is a leading cause of liver cancer. Millions of Americans have hepatitis C, but they're not aware that they do so. And treatments can eliminate the hepatitis C virus. History regarding hepatitis C. So, universal precautions came out for infectious diseases by the CDC in the early 1980s. With initial primary care screening, providers can educate patients on hepatitis C treatment and refer them for treatment before any long-term complications can arise, such as cirrhosis or liver cancer. Early detection of hepatitis C screening and treatment would decrease the number of patients with chronic hepatitis C. According to the CDC, they recommend testing for all adult patients for hepatitis C at least once during their lifetime, as well as more frequently depending on their actual risk factors, which we'll get more into in the upcoming slides. My thesis for my DNP paper is the specific aims for the project will be in patients age 18 to 65 in a primary care setting. Does the implementation of hepatitis C screening allow for referral and treatment compared to the current practice of no guidelines? So we'll look more into depth in regards to the results with no implementation of hepatitis C guidelines versus the results of what it's showing with actual implementation of guidelines for hepatitis C screening and treatment, as well as referrals. With current hep C treatment rates and the appropriate treatment, the duration of this virus by more than half would occur in the population by 2040. This is notated by Durham in 2015. So as we're looking at the annual treatment guidelines of 100,000 patients, treatment of 200,000 patients is projected to result in 289,206 fewer cases of cirrhosis and 143,055 fewer deaths through 2040. There has been a lot of data that's showing with improved screening and treatment of these patients with hepatitis C that we could actually eradicate the disease by 2040. Treating 400,000 patients annually is predicted to avert 526,084 patients with hepatitis C. This is also notated from Durham, page 301. These statistics prove that many patients suffer from a disease that is avoidable if screened earlier in the progression. And this is mainly because people are not aware that they have hepatitis C because symptoms do not show until they're end stage with either cirrhosis, which is liver, basically their liver is dead, it's not functioning to its highest potential, or they have nodules notated in their liver, which could be cancerous. Type of inquiry. The Practice Improvement Project had a buy-in from the stakeholders for an evidence-based algorithm for screening and diagnosing hepatitis C virus infection to be implemented in the primary care setting. An exploratory quantitative design through a retrospective chart review would be utilized for this quality improvement project. Data would be collected 3 months prior to the practice change and 3 months after the practice change. The time frame would allow seeing if the practice change was beneficial in increasing screening and referrals for treatment of hepatitis C. The hope is to continue educating providers about this virus since the treatment and screening process is constantly changing. Transmission of hepatitis C can actually be due to a variety of reasons. So, intravenous drug use is one of the highest transmission rates for this virus, and that's because a lot of individuals are using illicit drugs and sharing infected needles. Unregulated tattoos, so if people are getting tattoos and they're using infected needles from other individuals, sharing razors, sharing of toothbrushes, and infection from mother to baby. As you can see to the left of this slide, there is a quick photo of what the structure of the hepatitis C virus actually looks like. So at the top, we see the envelope, and as we go down, we see halfway down the RNA, which is the replication of the actual virus. So this is how it replicates from person to person. Per the CDC, approximately 2.7 million people in the US have chronic hepatitis C infection. This was notated from the American Liver Foundation in 2021. An estimated 50,300 acute cases in 2018 occurred. This is also notated from the CDC during 2020. Many people are wondering why hepatitis C continues to increase in numbers each year, and this is mostly because of the opioid crisis and the opioid epidemic. Injection of drugs have increased during the opioid epidemic. Transmission of hepatitis C has been transmitted from infected needles for individuals that are using recreational drugs. If they're treated successfully, it can prevent the illness from spreading. Many individuals do not know that they have the virus because they aren't being screened. If we're able to increase screening for this patients, it's recommended for earlier treatment to prevent complications. Again, this would either be hepatocellular carcinoma or cirrhosis. So as you can see, the opioid crisis has caused a lot of this specific virus to transmit from person to person. Many individuals are not aware that they have the virus. So being able to routinely screen for these patients at either annually based on their risk factors or at least once in their lifetime would help to prevent any type of long-term complications. So I'm going to get into a little bit of how we actually screen and treat for hepatitis C. So screening for hepatitis C, the first thing that we do is we use two lab tests, one being hepatitis C antibodies. These are specifically antibodies that are detected in the body. So if a person was actually exposed to the virus at some point in their lifetime, they will automatically come back reactive in the labs. Now, if you come back reactive, that will what we call reflex to a hepatitis C viral load. And this is super important for providers to take a look at because they're able to see how much active virus is in the body. To the right, this is a great representation of how the hepatitis C virus antibody will reflex to the PCR. So if we're screening somebody for, the virus that is either asymptomatic or their status of hep C is unknown, the first thing we're going to do is we're going to test for their antibody. As you can see to the left-hand side, it says that it's non-reactive. If it's non-reactive, we go down to the next point showing that no hep C virus is detected in the body. Now, if we revert back to the original series, if it's reactive, then we're testing the plasma for the actual RNA, which is the actual virus. To the left-hand side, if that's negative, they do not have a current hep C infection. Because they showed up reactive for the antibody, that actually means at some point in their life they were exposed to hepatitis C and had the active virus, but their body was able to clear the virus on their own. On the right-hand side, if the RNA is positive, that shows that they have a current hep C infection. With that being said, we would ensure that these patients are further worked up for the hepatitis C and treated effectively. Universal screening. Universal screenings are aimed at patients above 18, and they suggest that they have these screenings at least once within their life. High-risk individuals with either active drug dependence or known hereditary diseases would also be screened more frequent. So as we spoke about before, some symptoms of hepatitis C include jaundice, which is the yellow discoloration of their either skin or their eyes, indigestion and difficulty sleeping, swelling of the feet and legs, and number 4, liver complications, which we spoke about, either cancer or liver failure. Recommendations: one-time screening for chronic hep C infection in all adults over 18. If they test positive for hep C, it's important to refer to treatment before any long-term complications arise. 90% of patients sustain virologic response. This information here is showing once they're treated that more than 90% of patients actually have cured hepatitis C through treatment. Some of the prevalence in nursing: providers will strive to manage and treat chronic conditions of their patients. It's important to educate patients to ask to be screened for infectious diseases. Many of our patients are actually not aware of medical terminology or infectious diseases, so I do think as providers it's important that we educate and ensure that they are aware of diseases that can be transmitted. Patients using drugs through intravenous needles should get clean needles that are free from pharmacies. Unfortunately, it seems counterproductive educating patients that are using IV drugs, but unfortunately, if they're not willing to get help at that point, it's important that we make sure that they're safe using any type of drugs. Virus complications. On the left-hand side, I've shown a picture of what a healthy liver looks like versus to the right, where a liver is actually infected with hepatitis C. So as we spoke about, many patients are not aware that they actually have this disease until it's progressed where they're end stage. With this being said, you can clearly see how the liver is structured. So it doesn't appear as new and shiny as the healthy liver to the left-hand side. The right-hand side liver, because of the virus, it will slow down, it will not function properly, and eventually it will affect additional organs after the liver. It's important these patients with liver cirrhosis are screened every 6 months in order to ensure they are not getting any type of cancer. Concerns of the virus. If treatment is initiated, the body will not clear the virus. So if we think about it, if you're able to clear the virus on your own, then there's no cause for concern with the liver in regards to long-term complications. So treatment will need to be initiated if the body does not clear the virus on its own. Treatment-naive patients include antiviral oral options for either 8 or 12 weeks. With this being said, there are individuals that will need to be treated again, and the guidelines are a little bit more complicated, and there's a further workup that needs to be completed. But most patients will take this antiviral treatment for either 8 or 12 weeks. As you can see to the bottom of this slide, you can see a normal liver to the left-hand side. In the middle, you will see the cirrhotic liver. So this is actually showing hepatitis C virus that has come into contact with the liver and is causing the liver to not be as smooth. And the last picture on the right-hand side would be end-stage liver disease with hepatocellular carcinoma. So you can see this small nodule right here that's indicative of liver cancer, which is why patients with cirrhosis, it's important that they get these routine screenings and ultrasounds on their liver to ensure that we're looking for any nodules on their liver. Barriers of hepatitis C screening and treatment. Throughout my project, I've learned that there's a lot of barriers to actually screening and treating these individuals. So number one was finding a primary care provider who is actually taking new patients. In Rhode Island, there has been a lack of primary care providers and the ability to find a new provider. Many patients will lack initial screening and treatment of hepatitis C during routine office visits, even with the availability of oral antiviral medications. There is a lack of primary care providers to understand the virus and the concerns that comes with it. Many patients seen for hepatitis C acquire cirrhosis due to the barriers of providers screening and treating the virus. So this actually has to do with the lack of education. Many providers, no matter if they're nurse practitioners, doctors, they don't want to screen these individuals because they're not sure what to actually physically do with them. So I think the importance surrounding this project is to ensure that education is routinely being given to these providers so they're aware of how to screen for infectious diseases and they're not afraid to do so. The need for hepatitis C screening and treatment in the community health setting is very high, but patients lack the ability to pay for the antiviral medication. So without the authorization of insurance or having active insurance, that could be another barrier. Post-treatment continued. We spoke a little bit about the duration of the treatment for actual hepatitis. Patients of any age can actually successfully be treated for hepatitis C if they've had at least 1 year of life expectancy left. Being able to rid of the virus shows a decrease in liver inflammation and the progression of liver diseases. Being able to achieve SVR, which is sustained viral response, prevents long-term complications such as liver transplantation, cirrhosis, or cancer. SVR is particularly important with treating these individuals because we're able to see that they have been successfully treated. So with SVR, we're screening for hepatitis C viral load 12 weeks after they finish either 8 weeks of Mavorite or 12 weeks of Vosevi, Harboni, which are many different antiviral medications. The sustained virologic response is more than 90% in these patients. And these two facts were actually notated from Suradai in 2018. The results are very high, which in turn improves screening and treatment of hepatitis C. It's important to understand why treating hepatitis C is imperative for these patients. The result is to successfully treat these patients and not have any active virus in the body. When someone does not have the active virus, they have sustained virologic response, also known as SVR. This is confirmed by checking a hepatitis C viral load 12 weeks post-treatment. So again, this is what we just previously spoke about, but just to reiterate it, because sometimes hepatitis C can be a little bit challenging to understand. Hepatitis C in community healthcare can be very challenging, as we previously spoke about in regards to barriers. Hepatitis C antiviral treatment in community settings is clinically effective and is shown to be favorable in this specific population. Many patients will adhere to the medication schedule and completion rates will be very high. This was notated from Poor Marzl in 2019. Implementing a practice change for patients age 18 to 65 for proper screening and referrals will help aid in preventing long-term liver cirrhosis and hepatocellular carcinoma. Some project benefits to practice. Prior to my improvement project, there were no guidelines in place for screening for hepatitis C patients. It was beneficial for providers to have a concrete way of screening for this virus. Providers and patients continue to be educated on proper screening and initiation of treatment if they are positive. If patients continue to be educated early regarding hepatitis C and the damage that it can cause to the liver, they'll be more willing to get treatment at an earlier rate. Patients need to be aware of the ways this virus can be transmitted to them, so proper education during physical exam visits would be pertinent. Project results. For patients ages 18 to 65 in the primary care setting, implementation of early hepatitis C virus screening, referrals, and treatment prevented cirrhosis and hepatocellular carcinoma. Based on the data collected from this project, the next step would be to normalize screening for hepatitis C in the primary care setting. Before the intervention, less than half of these patients, 19 out of 50, were screened for this virus before the provider education. Once education was completed within the providers, it initiated consistent screenings for each provider's patients' panels. The size of the observed change before the project was less than 20%, and after was at 100%. There is nothing that needs to be done in the future differently to improve outcomes from these results. The size of the study was 50, which gave accurate and expected outcome data. Providers were giving the statistical data that showed the end consequences of avoiding the screening. Post-education and data collection, providers also understood the necessary reasons to screen 100% of these individuals to prevent further long-term complications. Data conclusions. The data shows the improvements within this intervention from pre to post intervention. There was an actual change in one direction, suggesting evidence of strength in this project. The nature of the setting and improvements within this intervention improve chronic complications of liver cirrhosis or cancer. Some patient education would be that if they're not able to spontaneously clear the virus on their own, they should be treated. They can get reinfected with the virus even once they're treated. If they have active hepatitis C, even if it's cleared in their body, they will never be able to donate blood products. And this is because the hepatitis C antibody will always screen positive, so the blood bank will automatically rid of the blood products. Hepatitis C will continue to be a cause of chronic liver issues. And if we're educating high-risk patients, we should always educate them to use clean needles and to not share with others. Other people that should be screened is every adult at least once, every pregnant woman, each pregnancy, everybody with risk factors regularly, so people with IV drug use. Conclusion. Some patients can have acute hepatitis C and their bodies will clear the virus on their own. Patients will always test positive for hepatitis C antibody, may not donate blood products as we just previously spoken about. This is because the body was exposed to the virus but does not exhibit active infection. Increasing the treatment of active IV drug users would prevent this virus from spreading to many other individuals. One other important information to touch base on is that after the intervention, 100 out of 100% of patients were screened for hepatitis C and referred for treatment. So that was 50 out of 50 patients, which showed this project had a strong outcome. Here are my references. Thank you.